Disruptive, impulse control, and conduct disorders represent a complex category of mental health conditions that significantly impact individuals, families, and communities worldwide. These disorders are characterized by persistent patterns of behavior that violate social norms, disrupt daily functioning, and often lead to considerable distress for both the affected individuals and those around them. The interconnected nature of these conditions creates a challenging landscape for mental health professionals, educators, and families who must navigate the intricate web of symptoms, causes, and treatment approaches. The foundation of understanding disruptive, impulse control, and conduct disorders lies in recognizing their shared characteristics while acknowledging their distinct presentations. Disruptive disorders typically manifest through behaviors that interfere with normal social, academic, or occupational functioning, creating friction in interpersonal relationships and institutional settings. These behaviors often appear as defiance, aggression, or persistent rule-breaking that goes beyond typical developmental challenges. Impulse control disorders, on the other hand, are defined by the failure to resist impulses, drives, or temptations that may harm oneself or others, accompanied by increasing tension before the act and relief or gratification during or after the behavior. Conduct disorders encompass a broader pattern of antisocial behavior that violates the basic rights of others or major age-appropriate societal norms and rules. The etiology of these disorders involves a complex interplay of genetic, neurobiological, psychological, and environmental factors. Research has consistently demonstrated that genetic predisposition plays a significant role, with family studies showing higher rates of these disorders among relatives of affected individuals. Neurobiological factors include abnormalities in brain regions responsible for executive functioning, emotional regulation, and impulse control, particularly the prefrontal cortex, amygdala, and limbic system. Environmental influences such as childhood trauma, inconsistent parenting, exposure to violence, socioeconomic disadvantage, and peer relationships significantly contribute to the development and maintenance of these conditions. The interaction between these factors creates unique presentations in each individual, making personalized assessment and treatment crucial. Oppositional Defiant Disorder represents one of the most commonly diagnosed disruptive disorders, characterized by a pattern of angry, irritable mood, argumentative behavior, and vindictiveness lasting at least 6 months. Children and adolescents with this condition frequently lose their temper, argue with authority figures, actively defy rules and requests, deliberately annoy others, and blame others for their mistakes or misbehavior. The disorder typically emerges during preschool years, but can develop throughout childhood and adolescence. The impact extends beyond the individual to affect family dynamics, academic performance, and peer relationships, creating a cycle of negative interactions that can perpetuate problematic behaviors. Conduct disorder presents a more severe pattern of behavior that violates the basic rights of others or major age-appropriate societal norms. This disorder is characterized by 4 main categories of behavior: aggression toward people and animals, destruction of property, deceitfulness or theft, and serious violations of rules. Individuals with conduct disorder may display bullying, threatening, or intimidating behavior, initiate physical fights, use weapons, show physical cruelty to people or animals, steal while confronting victims, force sexual activity, deliberately destroy property, break into buildings or cars, lie frequently, or stay out at night despite parental prohibitions. The onset can occur in childhood or adolescence, with childhood onset typically associated with a more severe prognosis and higher likelihood of developing antisocial personality disorder in adulthood. Intermittent explosive disorder falls within the impulse control category and involves recurrent behavioral outbursts representing a failure to control aggressive impulses. These episodes are characterized by verbal or physical aggression that is grossly disproportionate to the provocation or precipitating psychosocial stressor. The disorder requires that individuals experience significant distress or impairment in functioning due to these episodes, and the aggressive outbursts are not premeditated or committed to achieve some tangible objective. The episodes are often described as occurring suddenly with little warning, lasting typically less than 30 minutes, and followed by feelings of genuine remorse, regret, or embarrassment about the aggressive behavior. The assessment and diagnosis of disruptive, impulse control, and conduct disorders require comprehensive evaluation by qualified mental health professionals. The diagnostic process involves detailed clinical interviews with the individual and family members, behavioral observations, psychological testing, and review of academic, medical, and legal records when available. Standardized assessment tools such as the Child Behavior Checklist, Conners rating scales, and various structured diagnostic interviews help clinicians gather systematic information about symptom patterns, severity, and functional impairment. The evaluation must also consider developmental factors, cultural background, and potential co-occurring conditions such as attention deficit/hyperactivity disorder, learning disabilities, mood disorders, or substance use disorders. Treatment approaches for these disorders are multifaceted and typically require a combination of interventions tailored to the individual's specific needs, age, and circumstances. Psychotherapy forms the cornerstone of treatment, with evidence-based approaches including cognitive behavioral therapy, family therapy, parent management training, and multisystemic therapy showing significant effectiveness. Cognitive behavioral interventions focus on helping individuals develop better problem-solving skills, anger management techniques, and social skills while addressing distorted thinking patterns that contribute to problematic behaviors. Family therapy addresses communication patterns, boundary setting, and conflict resolution within the family system, recognizing that family dynamics play a crucial role in both the development and maintenance of these disorders. Parent management training has emerged as one of the most effective interventions, teaching parents specific skills for managing their child's behavior through consistent discipline, positive reinforcement, and effective communication strategies. These programs help parents understand the principles of behavior modification, implement structured reward systems, set appropriate limits, and respond to challenging behaviors in ways that reduce rather than escalate conflicts. The involvement of parents and caregivers is essential because they serve as the primary agents of change in a child's daily environment. School-based interventions play a vital role in addressing these disorders, as many symptoms manifest prominently in educational settings. Collaborative approaches involving teachers, school counselors, and mental health professionals can create consistent behavioral expectations and support systems across home and school environments. Individualized education programs, behavioral intervention plans, and classroom accommodations help address academic and social challenges while providing structured environments that promote positive behavioral change. Pharmacological interventions may be considered when symptoms are severe or when co-occurring conditions warrant medication management. While there are no medications specifically approved for conduct disorders, certain medications may help address associated symptoms such as aggression, impulsivity, or mood instability. Stimulant medications may be beneficial when attention deficit/hyperactivity disorder co-occurs, while mood stabilizers or atypical antipsychotics might be considered for severe aggression or emotional dysregulation. Medication decisions require careful consideration of potential benefits and risks, particularly in children and adolescents. The prognosis for individuals with disruptive, impulse control, and conduct disorders varies significantly depending on multiple factors including age of onset, severity of symptoms, presence of co-occurring conditions, family functioning, and access to appropriate treatment. Early intervention is associated with better outcomes, as it can prevent the escalation of problematic behaviors and the development of more severe antisocial patterns. Children who receive comprehensive, evidence-based treatment often show significant improvement in behavioral control, academic performance, and social relationships. However, some individuals, particularly those with severe conduct disorder beginning in childhood, face a more challenging prognosis and may be at increased risk for developing antisocial personality disorder, substance use disorders, or involvement with the criminal justice system in adulthood. This underscores the importance of early identification and intervention, as well as the need for long-term support and monitoring for individuals with severe presentations. Prevention efforts focus on addressing risk factors and promoting protective factors within families, schools, and communities. Programs that strengthen parenting skills, improve family functioning, enhance school climate, and provide positive youth development opportunities have shown promise in reducing the incidence of these disorders. Community-based initiatives that address broader social determinants such as poverty, neighborhood violence, and lack of resources also contribute to prevention efforts. The impact of disruptive, impulse control, and conduct disorders extends beyond the affected individuals to encompass families, schools, and society as a whole. Families often experience significant stress, financial burden, and social isolation as they struggle to manage challenging behaviors and access appropriate services. Educational systems face challenges in providing safe, supportive learning environments while meeting the needs of students with behavioral difficulties. Society bears costs related to juvenile justice involvement, special education services, and long-term consequences of untreated disorders. Despite these challenges, there is reason for optimism as research continues to advance our understanding of these complex conditions and improve treatment approaches. Ongoing studies in neuroscience, genetics, and developmental psychology are providing new insights into the mechanisms underlying these disorders, potentially leading to more targeted and effective interventions. The integration of technology in treatment delivery, such as online therapy platforms and mobile applications for behavioral monitoring, offers new possibilities for extending the reach and effectiveness of interventions. Cultural considerations play an important role in understanding and treating disruptive, impulse control, and conduct disorders, as behavioral norms and expectations vary across different cultural contexts. Mental health professionals must be sensitive to cultural factors that influence the expression, interpretation,